call this meeting to order, the Blackhawk County Board of Supervisors for January 30th, 2018. Roll call, Mr. Beater.
Leyland,
Here.
Little,
Here.
Schwartz,
Here.
Eichmann,
Here.
White.
Here, have a moment of silence to reflect on our actions of the day. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Have the agenda received
So
as
moved.
proposed or as amended?
Second.
Moved and seconded. I've got a quick change here. Due to the agenda error, we will not be holding the public hearing for the courthouse tile replacement project was scheduled for today. The public hearing and bid opening will be held on Tuesday, February 6th at 9:05 during the regularly scheduled board meeting. With that, all in favor, aye?
What motion?
You already had a
Motion to.
Yeah.
Yeah.
Aye.
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 Public comments? Anyone from the public like to comment about anything other than what's on the agenda? Come up to the microphone, give your name and address, please.
Good morning. My name is Arlene Prather O'Kane. My address is 1309 West 18th Street in Cedar Falls, Iowa.
Morning.
Iowa 613. Good morning.
Good morning.
Thank you for having me for a couple minutes. Chris was actually asked me to come and present to your board, so I've left you some documents in regards to public health essential services and what I'm reading this morning. I am Arlene Prather O'Kane, a Cedar Valley citizen, RN, and a retiree from the Blackhawk County Health Department. After 20 years of service in the health department, I retired in June of 2016. My membership is active in both IPHA and APHA. Over the past 19 months, I have remained active on the following advisory boards in the Cedar Valley: the Iowa Legal Aid, Together for Youth, Hawkeye Community College Nursing, STI Coalition, and I am the president of the Cedar Valley Preschool and Child Care Center in North Cedar. Over those 19 months, I have periodically visited my previous health department staff and tried to stay apprised of accomplishments and changes within the health department. I also have the ear of many friends and contacts in the community voicing their views and dismay to me about the status of our public health in our community and their perceptions of the health department. I appreciate the challenges of change and modernizing our health department. I realize accreditation for the health department has been a goal since 2015 when I was an employee. I come here today feeling the need to share with you perceptions from the community and my angst and concerns about the following. Communication and transparency of the Blackhawk County Health Department to the Cedar Valley community about updates related to public health issues and prevention messages are lacking in the media. For example, local messages reinforcing prevention about the widespread influenza in the country need to be reinforced from national messaging. STI rates are still highest in the state of Iowa, and particularly this county is the highest. Our health department continues to offer minimal hours for the public. This includes only one-day STI services, which frankly lends to poor confidentiality with everyone showing up on the same day with services. No evening hours are accessible for the public. In addition, when I was still working at the health department, the plan was to start billing for STI services with electronic medical records via the nurse practitioner, but to my understanding, revenues are still not being incurred after at least 3 years or more. Over a 17-month period, many long outstanding programs have been discontinued or changed. This includes the Home Care Aid Program, which in the biannual report of 2015-16 showed 100% of folks being able to remain in their homes due to this care. The Cedar Falls School Nursing Program being canceled as of December 2017. As a manager in my last year over the Cedar Falls School Nursing Program, budgets for this program and the Waterloo School Nursing Program always were well monitored. In addition, the Cedar Falls District liked our services since they came to us approximately 8 years ago to implement those services for their students. Although staffing was challenged at times, this was not anything new since we have been working with the Waterloo School District since 1996. The long-standing affiliation with Head Start programming ended in 2017. This service was a great transitional vector for children in preschool entering Waterloo and Cedar Falls School. The combining of the I-Smell program with application of the dental sealants in the schools, these are two very, very large programs, and the best service model would be to have coordinated by having 2 dental hygienists versus 1. Over the past few months, more layoffs and bumping within the health department has been noted than what has ever been shown over the past 35 years. During my tenure at the health department, I remember only 1 employee needing to be laid off. The standard historically was to make it work, and by not hiring or assigning staff to alternative work temporarily. The perception from the community of the stated above, cancellation of or change of programs, are of deep concerns and disappointment. This is not to mention the angst and poor morale of staff that are present. Finally, I also feel that the disaster preparedness needed by the health department is not updated at this time. In comparison to 2008 during the floods, the health department had a call-down list of staff, and most, if not all, staff were prepared and knowledgeable about their roles in incident command and what to do during a natural or man-made disaster. For the past few years, it is my belief that staff are unaware and unprepared for a disaster possibility. In my opinion, this is a scary situation and issue for all citizens of the Cedar Valley and needs to be rectified immediately. To summarize, I was compelled after seeing and hearing about the many changes over the last 17 months to come and share my views and concerns. During my 20 years as an employee, the collaboration and leadership of the Black Hawk County Health Department was always seen as a vital resource. The Black Hawk County Health Department was touted across the state of Iowa as being a leader for public health. I worry that perception is changing, not for the positive, but in the Cedar Valley and the state of Iowa. Thank you for your time and service to our community and listening to my views. If you want to contact me further, all my information is on below. I appreciate that.
Thank you
very much.
Anyone else? Good morning.
We're not gonna have a debate on this. We're not gonna have a debate on this.
Good morning.
Morning.
Good morning.
I am Reverend Mary Robinson. I happen to be Vice President of the Black Hawk County Board of Health. And the reason I wanted to be here for public comments is because I have a obligation that was scheduled some time ago, and I understand that our hearing is going to come at the end, and I will not be able to be here. So I wanted to give my comments now. You're going to think that we're probably talking about, from the last presenter, we're probably talking about 2 different boards of health, but we're not. We're talking about the same one. I have been on the board, was asked to come back. I think it was my 3rd, maybe my 4th. I don't know. It feels like it's been a lifetime. So I do come with some history. Before we hired, when we were looking for a director after Bruce retired, one of the things that the director, whoever was going to come on board, was charged with making some changes, because we had done, had asked all managers, every last one of them, to fill out a form with some questions, and 100% said there needed to be some changes. Staff morale, there were just some other things that needed to be fixing. And so we let whoever was going to be our next director know that that had to happen. And we were following the mandate of our managers. And so I'm just pleased to come to let you know that there have been some quality improvements made. You know, none of us like change. Well, I don't like change. And I want change until it impacts me. And then all of a sudden, change is not good, even when I wanted it in the first place. But I think that the department, no, I don't think, I know that the department is making strides. I just happened to think last night, as I was thinking about what my comments would be today, I thought about the article that appeared from the National Public Health Foundation back a year ago, and our agency was cited as one of the ways to actually make change and to make sure that there is performance management, and that is what we were very much lacking in. And so there was a consultant that came in to help us gain an understanding of where we were as an organization and to establish a foundation of knowledge for all participants within the health department. And this team spent many hours of quality time together, structuring goals, objectives, and measurements for each division that best aligned with the health department's strategic plan and programmatic priorities. And so there were 3 goals, and that was to strengthen agency capacity, to assure a prepared and protected community, and I underline protected, and to promote a healthy community. But our agency, the reason we made the national publication was that our agency went beyond those 3 things. We ended up refining our objectives and our measures to support our strategic goals. We worked to develop the plan for deploying and monitoring our systems. And we worked on developing a plan for communications. And so we were recognized because we, more than most departments, went beyond what was called for because we really want strategic change. And so why does this matter? It matters because we know that we have our public as stakeholders. Our public depends upon us to be ready, depends upon us to be knowledgeable. And the other thing was that we're not accredited, and we are now in the process of working toward accreditation. And so if our staff is saying there are some things that need to be changed, and we're talking about becoming accredited as a public health department, then there's no way you're going to have the 2 gel. And so we had a work session with the board, I think with the Board of Supervisors as well. I think you were there. And we talked about the things that we would need for accreditation. That means that there's going to have to be some changes. And so when the team met, they formulated a plan for communicating about performance improvement, to strengthen staff understanding, and to increase engagement with the public. Additionally, strategies were developed for regularly updating the Board of Health. We've had updates in ways that we have not. We've had involvement in ways that we have not before. And so the agency has focused on practical and applied approaches to training that allowed us to move quickly from our shared understanding about our strategic plan to a completed system or completing a system and a process for managing it. And that requires team unity. It also requires an understanding of what the issues are, an understanding of the stakeholders, and an understanding, obviously, of public health. I applaud the successes of the department in these areas. I think that this is something that we can be proud of. Some of the comments that you heard, this is not a debate, and so I'm not going to enter into a debate. I would take some issues with some of those. However, everyone has the right to their own opinion about what is happening. Throughout 2015 and 16 and beyond, we are concerned about improving the community's mental health, for instance. We're concerned about making sure we work in conjunction with Blue Zones and Food Corp and Healthy Cedar Valley Coalition to promote student wellness as well as other wellness. The other thing I just want to leave you with is that we are now a community with representing over 20 different countries from around the world with 60 different languages spoken in our communities. And so this is a new day in terms of how we do public health, how we communicate to the community, and until and unless we understand internally what that means and how to process it and how to make it happen, we're going to be just inundated with problem after problem and not know how to handle it and what to do about it. You might remember the Ebola crisis that was a few years ago. That was all new to us. And this isn't the only kind of new things that's coming. Food safety, so many areas have changed. And we as a department are trying to change in a positive way to reflect the realities of our community. And so I want to thank you for your time.
Thank you.
Thank
you.
Anyone else from the public? Moving on to claims and payments. This is a resolution from the Board of Supervisors to approve expenditures for the county.
The county's expenditures this week total $292,782.02, 292,782.02.
I'll move on the resolution.
Second.
Moved and second. Any discussion? This resolution, please answer as your name is called.
Leyland,
Yes.
Little,
Yes.
Magsman,
Yes.
Schwartz.
Yes.
White.
Yes, resolution adopted. Resolution to adopt expenditures for Country View Care Facility.
Country View's expenditures this week total $59,021, 59021.
Move to approve?
Second.
Moved and seconded. Any discussion on this item? This resolution, please answer as your name is called.
Little,
Yes.
Magsman,
Yes.
Schwartz.
Yes.
Leyland,
Yes.
White.
Yes, resolution adopted. Next is number 4, receive project updates from department heads and elected officials. Good morning, Kathy.
Morning.
Good morning, Board. Kathy Nicholas, County Engineer. Just very briefly this morning, all roads are in fairly good condition. I did want to update you on our Grundy Road paving project. The Grundy County Auditor called yesterday and just checking to make sure that we are still programming our Grundy Road improvements in our 5-year plan. The supervisors in the county there are interested in that. I did say that we are planning to include money in our right-of-way in the FY19. Should that be approved? And we are planning to update the 5-year plan again, probably in a month, and I would be updating you. And if you would like, we can then schedule a meeting with those supervisors as well. I believe we met with them about approximately a year ago to discuss the improvement on Grundy Road. So more to come on that issue. Thank you.
Thank you.
Thank you.
Any other department heads or elected officials? Not moving on to number 5, minutes approved for January 23rd, 2018.
So moved.
Second?
Moved and seconded. Any discussion? All in favor, aye.
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 Opposed, motion carried. Consent agenda by
So
resolution.
move.
Second.
Moved and seconded. Discussion on any of the items. If not, this resolution, please answer as your name is called.
Magsman,
Yes.
Schwartz.
Yes.
Leyland,
Yes.
Little,
Yes.
White.
Yes, resolution adopted. Next is contracts and agreements. A resolution that the service agreement between Blackhawk County, Iowa State Association of Counties to become a participant in the ISAC HIPAA program with an annual fee of $1,950 be approved and recommended by Kim Veeder, IT Director.
So moved.
Second?
Moved and seconded. Any discussion?
I don't think we mentioned in the motion, but I thought we probably should have included the cost was $1,950.
It's in the resolution.
For that item.
With the resolution, please answer as your name is called.
Schwartz.
Yes.
Leyland,
Yes.
Little,
Yes.
Magsman,
Yes.
White.
Yes, resolution adopted. Other business. Motion that the request for purchase of capital equipment submitted by Kim Veeder, IT Technology Director, be approved and direct the chair to sign for same to purchase 6 tablets, 1 laptop, a docking station for $11,668.64, and 6 Office 2016 professional softwares for $2,139 from Sterling Computer CDW-G to be used by food inspectors for the health department.
So moved.
Second.
Moved and seconded. We have that many food inspectors? Or Kim, is it? Do we have that many food inspectors? This is, all in favor, aye?
Aye.
Opposed, motion carried. Motion that the appointment of Vince McFadden as representative for the Blackhawk County Eminent Domain Board be approved effective of January 30th, 2018.
Second.
Moved and seconded. This is to fill in for a person that passed away. Moved and seconded. All in favor, aye?
Aye.
Opposed, motion carried. Motion that the personal requisition for the temporary summer helper intern position with no job offer to be extended until the budget has been approved and only after the adoption of the fiscal year 19 budget on July 1st, 2018, in the Injury Department be approved as recommended by Kathleen Nicholas, County Engineer.
So moved.
So moved. Second.
Moved and seconded. Any discussion? All in favor, aye?
Aye.
Opposed, motion carried. Motion that the personnel requisition for Assistant County Attorney, full-time, in the County Attorney's Office be approved as
moved.
recommended by Brian Williams, County
Second.
Attorney. Moved and seconded. Any discussion on this item? All in favor, aye?
Aye.
Opposed, motion carried. Next, motion to accept the resignation of Dennis Coleman, Country View Administrator, effective February 21st, 2018.
So moved.
Second.
Discussion? Dennis, would you like to say anything? I think, okay, thank you. Moved and seconded, all in favor, aye?
Aye.
Opposed, motion carried. Next, we're going into the work session for possible board action, considerations of all aspects of the 2019 Blackhawk County budget.
First up, we have a couple representatives from organizations that are requesting funding. So we have CAMYAR from the UNI Local Food Program.
Morning, Cameo.
Good morning.
Morning.
Nice to be with you. I'm Kamyar in Cheyenne, 1703 Washington Street in Cedar Falls. First, I wanted to thank you for your service to our county, and thanks for kind of inspiring confidence in local governance through careful and excellent work that you do. Thank you. I'm here to report on accomplishments of the funding that you provided to us last year. We had, I'll be very brief, we served 5 neighborhoods in Waterloo, and we reached 606 families that they purchased fresh vegetables at very affordable rates. That was about 5,300 pounds. We hired 5 neighborhood youth to help in that process. We supported 12 local farms. It's really amazing what that small enterprise did. But more importantly, our VISTA members, AmeriCorps members who are serving doing this, wrote grants that leveraged, that actually brought in $75,000 in grant to expand this type of work, which improves access to fresh vegetables in populations in need in our county. This is what we accomplished. I gave a handout. I'm just highlighting a few items. What we would like to do for the coming year, what's on our plate, we obviously want to expand this program, so we'll continue to do that. But our big project that it's in the works is collaborating with the Northeast Iowa Food Bank to develop a farm that employs people, creates opportunities. We have contacted the correction with the sheriff's office. People coming out of the correction system will have places to work in addition to many other people. So it's going to be a place where significant quantities of vegetables are produced and then moved through the food bank system. So that's a really and former Supervisor John Miller is helping us locate the land. We already have several possibilities, so we have our plates full. We will be hiring 9 full-time AmeriCorps members through the grants that we've received. So the $5,000 fund that you provide us becomes a match. It's a very small part of a big project, but it's like huge. We've been able to leverage that significantly. So that's just a brief summary of what we're asking. Any questions?
Thank you for what you do, Camiar.
Yeah.
Greatly appreciated.
Thanks for
Thank you.
developing this sheet here, so we got insight on what the money does. Thank you.
We also have Michelle Jungers with Iowa Legal Aid.
Thank you. Good morning, Michelle.
Good morning.
Iowa Legal Aid. I'm the managing attorney there. Here this morning to give you an update. I did provide a report beforehand, kind of a much more detailed report on the work that we've done over the last 6 months. So here to kind of highlight some of that, and then just request just continued support for the work that we do. So as a reminder, we received funding, and we've historically received funding to represent individuals who would otherwise be dependent on the county. Typically, those cases are SSI, SSD appeals. And so when we represent an individual, I mean, usually it's at the administrative law judge hearing process. That's about an 18-month. From the time you appeal until the time you actually get a hearing, it's usually about an 18-month wait. So during that time, many times the county is paying for that person. And if we are able to represent them and get them on benefits, and I put a story of, I think, at least one woman who we were able to help her update her medical records and get her approved without having to wait a much more lengthy period of time. So when we get them approved for benefits, the county is reimbursed those funds directly from their back benefit. So over the course of the last 6 months, we were able to secure benefits for 5 individuals, and that meant back benefit awards for those people of just about $70,000. So, and of that, we estimate that around $14,000 is then returned to the county in benefits that the county would have been providing to those individuals. And that's just what is provided to the county. That's not really taken into account the fact that federal dollars are now coming in to support those individuals going forward, so that the county isn't providing additional support. As my report notes, we have currently 31 cases that are SSI, SSDI appeals at various stages. And some of those we've had now for a couple of years. They might be at the appeals council level where we're briefing. And then I also just put some other information about other types of cases that we are providing assistance in with to Blackhawk County residents that also brings in a benefit to the county. We do housing work to make sure that our residents have safe and stable housing. We do unemployment cases, food assistance appeals, and then we've seen actually, I would say, an influx, and I can just say anecdotally, of people who the Social Security Administration has determined that they should not be getting benefits anymore. So our representation of those individuals is really to keep them on benefits and to keep them from at some point becoming dependent on the county. Like I said, my report kind of details some other areas, but illegal evictions. We've seen, situations where an individual receives funding to help them avoid an eviction, and after getting that funding, the landlord is still filing an eviction. And we've been able to successfully have cases dismissed. One that I highlighted in the report, we should not certainly be spending our county money providing rental assistance if after that the landlord's still seeking to evict them. So that's just kind of a sample of what we've done. Like I said, most of the money that's used, most of the funding provided does go to that SSI, SSDI work. So thank you.
Thank you.
for letting me give that report.
Thank you.
Okay. We're going to move on to the health department. Chuck, if you can put my screen up. Oh, actually, if you can do the podium screen.
Water.
cough drop over there.
I got it.
Well,
So it shows revenues down, Susan?
I think, yes. Let me just talk about this for a minute, and then I'll have them switch. So this is the Health Department budget summary. Yes, revenues are down slightly. Salaries and benefits are down due to the restructuring that the Health Department is doing. Operating expenses are up a little bit. And capital, we can talk about that. But I'm going to let Nafisa discuss her budget simply because they are doing a lot of reorganization and restructuring. And so there have been many changes. And so I will, Chuck, if you can put the podium screen up, please.
Good morning, Board of Supervisors.
Morning.
Morning.
Before I begin, I would like to just take a brief moment of your time before the budget to kind of respond to some of the public comments that you have heard today, if that's okay with you.
Yes.
Upon my appointment, the Board of Health emphasized a need to examine the health department structure to ensure that we are meeting the health needs of the community, a structure that is representative of a public health framework, and a structure that will meet public health accreditation. Thus, my priority was to restructure the health department in such a way that it meets the essential services of public health. I also made it a priority to diligently monitor the fiscal health of the agency. Some of these contracts that were previously discussed have not been negotiated for the past previous years, and so that was something that I took it upon to do. But the most important issue that I think that Ms. Prather has mentioned today is the STD rates in Black Hawk County. Black Hawk County has experienced high rates of chlamydia and gonorrhea for the past 10 years or more, and this has been alarming since my arrival. And one of the very first interviews I did with the Courier was on STD rates, whereby I stated we're doing more rigorous data analysis to be able to target very defined groups that are having these high rates and what are the interventions that need to be set in place so that they can be more testing and receive treatment within these groups. I also met with Board of Supervisor Chris Shorts on January 10th, where we discussed the health department's approach in tackling our high STD rates. The promotion of testing and especially partner disclosure is critical, and we have to find the best approach for each vulnerable group. Not one shoe fits all. My department is working hard to equip ourselves with the necessary tools to implement effective community health promotion and intervention programs. We are presently in the process of recruiting a health promotion program manager whose responsibilities will be to make sure evidence-based health promotion initiatives are well implemented in the community. The clinical structure of the health department will begin its evaluation after quality improvement training to enhance our services. Furthermore, for the widespread influenza epidemic, we did provide numerous occasions information to KWL, where we also emphasize prevention mechanisms. I also have an interview scheduled with them on Wednesday. But one of the most important things I want to say, it's important for me to emphasize that in order to improve public health, we must diligently review and evaluate the effectiveness of our programs. I do not and will not make subjective decisions that are not well researched, because at the end of the day, it's real people behind these decisions that we are making. So I cannot allow that to influence my decisions. I just wanted the Board of Supervisors to be aware of the process that I use to make some of these key decisions. Thank you. Okay, so I thought it was important to kind of give you all a brief overview of public health before I go into my budget, because I think it explains a lot of how my budget is aligned. So I'll begin by just defining public health, and that is, it's the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. Overall, public health is concerned with protecting the health of entire populations. These populations can be as small as local neighborhood or as big as an entire country or region of the world. Public health utilizes a framework, and this framework is called the Essential Services of Public Health, which you see on your right-hand side. And the Essential Services of Public Health describes the activities that state, tribal, local, and territorial level agencies have to partake. It's used as a foundation for the National Public Health Performance Standards, and it provides a structure for national public health accreditation. I began my position in August 29, 2016, and the review of the Public Health Department organizational structure began on September 13, 2016. We did it by evaluating our programs based on the 10 essential services of public health. We identified that most of our services capture the essential services of public health. However, we were able also to see where our gaps lie, and these were in three key areas. One, the mobilization of community partnerships and action to identify and solve health problems. The second, the development of policies and plans that support individual and community health efforts. And the third, the evaluation of the effectiveness, accessibility, and quality of personal and population-based health services. So what drives the health department budget? Well, the first thing is Iowa Code Chapter 137, which is to protect and promote the health of residents and visitors of Black Hawk County. The second, we have a strategic strategic plan and a health improvement plan. So we review our strategic plan and our health improvement plan, and we look at the key goals that we have established for fiscal year 19 and how it aligns with our budget. Thirdly, the federal and state budget decreases or increases. We have to take into account those potential, especially now in this climate, those potential public health decreases. And third, the organizational restructuring. I put in my blue packet the organizational chart. This might be too small, but I wanted to kind of touch base with the Board of Supervisors to explain our current organizational chart that has been approved by the Board of Health. The first thing, one of the first comments that was made was the home health care program. That program, yes, it was a program that was internalized with us, and it was funded by the local public health services grant. That funding now is really a funding that is emphasizing our need for public health accreditation. So that was one of the key reasons why the home health contract was subcontracted to VNA and Covenant Secure Center. We also one of the things that I've found out through this process is that those two entities had patients that were coming out and of medical care and really needed some temporary services before they could get on Medicaid. So it was a really good relationship that was formalized behind this. You will see that there's a deputy director position. This is something that the board, since fiscal year 18, we have been in discussion with. And I spend numerous times looking at organizational chart, public health organizational chart in counties that are similar to us and basically in population size. And the deputy director oversees program managers. Most public health organizations do not have a divisional structure that we have had in the past. And therefore, that is why you see that this chart is representative of a non-divisional structure, whereby the public health director will maintain the administrative, the fiscal side of the agency and the planning, and the deputy director will oversee program managers. The boxes in the blue are areas that we are looking into evaluating after quality improvement, and those are our clinics, with just looking at the clinical framework. This is something that I think it's important for us to do. We are in the process of recruiting a health promotion program manager. That was one of the things we also were able to identify based on the needs of community mobilization, is that we do need to conduct more rigorous health promotion. And so that position was approved by the Board of Health. Is there any questions for me thus far? Okay. So for our budget, we are proposing for fiscal year 19 will be funded by $3,772,393 in operating revenue, resulting in a total property tax asking of $2,339,126, which would be an increase by 3.34% over fiscal year 2018.
And that's all in your operating budget?
Yes. And also, so for fiscal year 19, one of the changes, especially with the FTEs, is the inclusion of a full-time deputy director position, replacing 2 division managers' position, the inclusion of a full-time disease surveillance and investigation program manager position, the inclusion of a 0.6 FTE community coordinator position. This particular position was also requested because of the Healthy Homes. We received a HUD grant in conjunction with City of Waterloo, and the inclusion of a full-time clerical typist too, aligning with our strategic planning goals to be accomplished in fiscal year 2019, and public health accreditation, the application fee, the training and education that also requires with public health accreditation.
So the end result in FY19, are you increasing employment at the health department or
No,
maintaining the status?
We are,
I understand the 2 that were eliminated, the 2 positions.
so for fiscal year 19, we're actually less, I had that chart, sorry.
It shows a 8.7 reduction.
Yes, for fiscal year 18, we're at 83.03 FTEs, but for fiscal year 19, we're at 71.18. Okay, so just going back. Oh, I had it in another slide, sorry. Okay, that was the previous slide, but yes, this is where we're at. So strategic planning goals, I just wanted the Board of Supervisors to be aware. We have health planning and development. We're looking to update our community food vulnerability assessment for Black Hawk County. This is an assessment that actually Dr. Kamyar had done for us. We need to update it from 2013 just to see where the vulnerability gaps are within Black Hawk County in terms of food accessibility. Again, ongoing accreditation, documentation, improvement planning, and preparation for documents based on self-assessment. We have registered an EFAB, which is indicating to the Public Health Accreditation Board that we have an intention of applying for public health accreditation. We are hoping to submit our application in July. Informing and care coordination, the board has approved the newcomers program, which is assisting newcomers within the community to access direct healthcare services. It's a massive need that is needed. Of course, staff training, and one of the things for our strategic plan was the workforce assessment to identify barriers to attract an optimum workforce. And we're very fortunate that the University of Iowa is going to facilitate that for us and for free. So that was important for me to highlight. Just some of our accomplishments. I know that our health department has been going through a lot of organizational restructuring, and it change is very, very difficult. But at the same time, we've really made some great accomplishment. This is our public health accreditation timeline. We've hit practically almost every goal that we have established. Right now, we are doing a detailed self-assessment to identify documents, which is estimated to complete May 2018. We are on track. Our intent, again, is to submit our application for July 2018. So we're really doing the hard part now. And with that comes a lot of training. It comes, we have to, every time we deal with contract negotiations and it doesn't happen accordingly, we have to restructure, go back to the drawing board. So I just want the board to be fully aware of where we are in terms of our timeline. We've established an accreditation slogan and logo, which is Public Health at its Best for Black Hawk County Health Department accreditation. Reverend Mary touched base a little bit on this. We have established a performance management system. We held a legislative forum on December 5th. We are also doing one of the really great initiatives that have been promoted actually for local health departments that are closely aligned with universities. It's called an academic health department, whereby the university system and the health departments share mutual resources. And so we've begun the process of building an academic health department with the University of Northern Iowa. We had the Health Department and Covenant Mobile Vaccination Unit launch with the meningococcal vaccination requirements. It was really a great collaboration with Covenant, and we were able to get children vaccinated and on time ready for school. We have launched a free private well water testing, which you'll see the campaign in your packets. And so far, we've tested 147 private wells, which were completed by December 2017. And I also urge Board of Supervisors, if you can go on our website, we do have position statements that the Board of Health has approved. Review them, read upon them. This is another form to advocate for our department and some of our needs. And so this is just a flyer. Reverend Mary touched this. This was where the health department was highlighted with the Public Health Foundation in terms of our performance management system and process. Any questions?
I guess when you're looking at the services that the health department provides, you're working with the local healthcare facilities, hospitals, and coordinating with them in how you develop your plan for the future?
Yes. Which services in particular?
Well, I don't have specifics, but I know that there are some opportunities to work with our hospitals here in Black Hawk County.
Yeah, so I think one of the things that as a community we've realized is that we need to come at the table for very specific goals. For example, in our health improvement plan, we talked about heart disease and stroke. And so we were able to, with my epidemiologist, kind of do some data analysis to see where the high-risk populations are. And those are initiatives with the hospitals we can work on. And also, one of the things that we do with physicians, we have what we call Residents Week. And they come and they learn about public health and some of the interventions that they can apply. The Northeast Iowa Family Residency Program is doing a conference in which they're looking at incorporating medical and behavioral, which I'll be a part of as well. So yes, so we look at very defined things that we want to address, and we work together to address it. But yes, we have to take a very collaborative approach. That's the only way.
Yeah, I know the state health department is looking at how local public health can perhaps look at regionalization. Not saying it's right for Blackhawk County, it's just something that
Yes.
is going to be emphasized from the state.
So one of the, in particular, our preparedness grant, that's one of the grants that was really regionalized, and we've been working together. It's an 8-county coalition. It took some struggles for us to become more in sync, but I think now we're getting there. The state has taken an approach of wanting to build a more systematic form of thinking. And that means that instead of it being so focused on grant-driven or goals and objectives, like what's this system, look at the overall system. But I think even for us to be really an efficient and effective health department, we do have to take that approach. And so that's why even on my organizational chart, one of the things that I intentionally did was not just place grants. So we have like the Iowa Nutrition grant, but if I place that, you have staff just thinking about the grants, meeting the goals and objectives, when you have to think about it at a much larger scale. So that's why you call it nutrition services or mental health services, not grant driven, but look at it from a much wider conceptual framework. And so even for our STD clinics, it's instead of it being very siloed, is could we potentially collaborate enough to where we can have Blackhawk County Health Department clinics, and those are the kind of models that it's important, because then you get a more synchronized form of doing things, and I think that's where the state is heading. Last year they've asked us to be chief health strategists, and that requires quite a bit of research. With my epidemiologists, we're submitting an application to the state whereby we will have a lot more access to data, so that at the health department we have a data hub. So it's not just looking at descriptives, which you'll see the STD data will tell you, oh, this particular population has high rates, this rates, but then what is it about that population that's causing these high rates? And you can only do that when you have more data to do more rigorous analysis. And I think that's why the collaboration with you and I, professors, will be effective. Mm-hmm.
Thank you.
Any other questions? Thank you, Nafisa.
Thank you.
Nafisa, can you hold on a minute?
Okay.
Chuck, if you want to put my screen back up. So the health department, as Nafisa mentioned, the increase in tax askings was $75,661. They do have one capital request, and I just wanted Nafisa to be able to speak on that, or Patty. They had brought it last year. It's the four-wheel drive SUV, I believe, for the testing of the wells, and I'll let you go ahead and.
Okay. Good morning. My name is Patty Humple, and I am the financial manager at the Public Health Department of Blackhawk County. We are requesting a new all-wheel drive or four-wheel drive vehicle for the health department. Our health inspectors operate under County Ordinance Title 8, Health and Safety, and Title 13, Public Services for Rural Well Water, Private Wastewater. This is part of their job responsibilities. This new vehicle would primarily be used in Blackhawk County doing well water checks, well reconstruction checks, and well plugging checks. We currently do not have a vehicle in our fleet with all-wheel drive or four-wheel drive, which would provide safety for the county employees driving over all kinds of terrain in Blackhawk County rural areas. Currently in fiscal year 18, as Nafisa said earlier, we've done 147 well water tests, 7 well closures, and 4 well reconstructions, all in Blackhawk County.
I think the question we had last year for you, why now? How'd they ever get them done 40 years straight.
This,
You're still driving out, you were driving out to these wells before. Is it a personnel change?
no, it is more of a, from what my understanding is, a state mandate that we go out and check these wells and get
And
them
you
all
haven't done that
tested.
before?
Correct. Not as much. Very little.
What are you using now?
They have a F-150, which is, let me make sure I get the right year on it, an '09,
How many miles is on that?
just under 100,000. And it just has the two-wheel drive. And then we have a Ford Ranger, about the same age, same
Have they
miles.
experienced problems?
Yes, they have.
You plan on rotating the truck then?
We could either do that, or we're thinking maybe of rotating. We have two small Chevy vehicles. They're 08s. Is it Aveo or Aveo? A-V-E-O. They're very small, and nobody really feels safe with them driving in the winter. They don't really have too much traction. We've been thinking about maybe trading those in or giving those to another department that might need them.
Both of them?
Mm-hmm.
How many miles on them, you know?
I can give it to you just a second here. I think they're right about 50.
What do we buy those for? For gas mileage?
They were used for the home care aid program mainly, yes, I would guess so. Those one has 55,000 and one has 58,000.
So you plan on getting rid of those two if you pick up a pickup?
Yes, sir.
And the amount you put in, the 28,000, I assume, and you've priced them somewhat.
We priced them, but I know the last time we bought a vehicle, we were able to get underneath what we thought we could buy it for, so hopefully we can do that again this year.
Through a bid process?
Yes, sir.
Any other questions?
Susan, do you have anything else on this budget? You said it was an increase of 70.
Yes, 75,661 is the increase in tax askings, or 3.3%.
I think fuel went up.
Fuel has gone up. We've also had more expenditures for tires and batteries as our fleet is aging.
Who services your vehicles?
City of Waterloo.
Fuel there?
Yeah, yes, and some also have a contract with City of Cedar Falls.
What do you pay for fuel?
It varies. I can show you costs. We're not paying tax, obviously.
Sure.
It's been a little over $2, $2.21 the last time I looked at it, but it varies every time we get a bill.
Nafisa, do we still got plenty of immunizations available for people to get shots?
Yes.
This morning they were saying there's a shortage in some places, so I didn't know if we were one of them.
Yeah, and I'll be doing a presentation. KWWL is going to come. One of the things is that we're seeing a stronger strand of the virus, and so, but people still need to get vaccinated, especially the young and the elderly. The vaccine is at least 40% up to 60% effective, and so we really want to promote that. It's just people need to do that.
Thank you.
Thank you. Thank you.
You have any other questions on the health department?
I want to thank you, Nafisa, I think, for your outreach, including the Board of Supervisors in more meetings than we've probably been on previously from the Board of Health and keeping us informed, so thank you.
The next topic that we're going to move on to, salaries and benefits. And I'm going to start by looking at this non-bargaining equity issue that was raised last year. The HR department did a study last year, brought it to the board's attention, and I think you've received several emails on this subject, and I can let Debbie, if you need to, just kind of like go over just in summary what the issue is. But last year, the total amount that Debbie had come up with that would correct the issue, I think, was a little over $200,000. And the board last year determined that we couldn't fund all of that in 1 year. So HR proposed a sort of a multi-year approach where we would adjust those individuals who had been in their position for at least 3 years and make sure that they were at the midpoint of their pay scale. And so the correction last year, I think the total amount was about $60,000. I can't remember how much impacted the general fund. This year, the total amount is $19,000, with only $5,000 impacting the general fund. There are some individuals from county social services, and that will not impact their levy. And actually, county social services is, I know, working to try and figure out a plan to put all of their employees under the same sort of umbrella. So that might, change with that. And then there are a couple individuals from Country View, and then one from the that is paid out of the jail commissary fund. And so
Isn't that a part-time position?
it is. And so since that's the sheriff's commissary fund, I'm not sure, we haven't communicated this to the sheriff, so we can just, and that adjustment is very small. Looking ahead in the next couple of years, if we continue with this process, the total amount for FY20 would be about $20,000, and in FY21, $27,000. And then when we get to 22, these are the new hires, and so far there would be $6,000. But as we go out, what I think the HR department hope is that we need to develop a new system for compensating non-bargaining. We need to look at this, and hopefully we can discuss that as part of our strategic plan as we continue to look at that and come up with some options for how we can, I guess, adjust the compensation structure so that we don't run into these equity problems going forward. But I'll let Debbie talk a little more about that.
Right. Morning, Board. Debbie Bunger, HR Director. And my position here is just to be kind of more in a proactive stance. I think that, ounce of prevention is obviously worth a pound of cure. When you look at how our non-bargaining has been working so far, it's been about 13 years since we changed the structure. And so you have to kind of monitor and see how it's working. I think it's good that our pay plan has actually advanced with the across the board, so that's kind of kept our non-bargaining pay plan in sync. But the thing that hasn't happened when you compare it to the bargaining is that the bargaining gets the across the boards and step increases where the non-bargaining stays. So eventually it's just kind of a mathematical issue is eventually there's going to be
Does all the bargaining units have a step program? I thought some of them didn't.
No, they all do. And the average step, if you add them all together, the average is about 4%. Some are less, some are more. And then the average to get to the top is about a little over 8 years.
What was discontinued back in 04, 05, I believe?
I think it was at the end of 06, June.
Why wouldn't we just reinstate it?
And that's a possibility.
A resolution did it. A resolution can bring it back.
Sure, and that is one of the options, and one of the cost factors that I looked at last year is if we actually went back to a step system and we put everybody on a step, kind of where they would be on that step right now, what that would cost. And I guess there's a couple different approaches you could take. Would you actually move them to that step, or would you just start them where they're at and then continually begin to move them from there? So those are things we can look at, and so that we don't have to bring this back to the board every year. When you have a strong union environment, that is one of the challenges of having a different kind of a pay structure for your non-bargaining. And I think that's why it worked so well before, and we didn't kind of have some of these issues.
So how long does it take a union member to get to midpoint?
About 3 years, and some actually maybe a little bit less, because a couple of them
So
actually
these people we're talking about, are they And who's complaining? Is anybody complaining in this courthouse about what they're getting paid?
Well, you know, I think we don't really want to wait for a complaint, because here's the problem. I think we know enough to know what we should be doing. And with pay inequities, if somebody does bring a claim, we want to make sure we're on the right side of that claim. And that's part of my job, is to make sure that we're not at risk.
We got to remember the community too.
Absolutely,
Our
Craig, I
community, it
appreciate
doesn't
that.
fit, this shoe doesn't fit every person. You know, this community has a lot of people on
Understand that, yep.
low-income jobs, and so they're affected by everything we do. And then we look at $5,000 and $6,000 raises for people. Hell, that's 1/3 of what some of them people are making for a year. And we're telling these taxpayers, oh, well, these people are worth that much more money. They may be worth that much more, but I don't hear anybody coming in my office complaining about what they're making now.
I think we'd be better off, Deb, to come up with a system. I think the reason they discontinued it back whenever you said, because they thought that the system was antiquated.
Right.
And I think management kind of felt that too. There's got to be other plans out there. Now, at one time, HR come to us, and I forgot what the cost was, but it was like $400,000 to do a study, which is ridiculous. We should be smart enough to figure out what kind of pay schedule for non-bargaining
Right.
to set up, and then we live by it. But at the same time, we've got to be kind of frugal on this. One term I hate, and I'm not criticizing Susan, but when you say only $5,000, that only term should never be used when you're talking about taxpayers' money. Because only $5,000, it's $5,000 no matter how you look at it, and it's not your money, my money, it's the taxpayers. I think we'd be better off trying to come up with a system, and that would be fair for the future. Obviously, Blackhawk County is not having a turnover of employees. They haven't since I've been here for 13 years. And I know we tried to do that comparison with other counties, but I've always been adamant that each county is different. The makeup of the county is different. The tax base is different. And what I pointed out to Susan the other day in that email she sent to us, the leaders of Blackhawk County, your elected officials, they're all far behind. I mean, they're ranked, for being the 5th largest county, they're all ranked down. And
We all lag the market with that, and unfortunately, there's not anything I can do for the.
No, I understand that, but I guess people.
If I could, I would be up here proposing that, because I do
I
understand
understand
that
that.
you're at like 78%, I think, of the median.
Yeah, and that's fine, because we have the option to run or not to run. The only other thing too, I look at some of the names are on that list, and they're all good employees and good workers. But some of them, if not a majority of them, had increases already, 25% increases from their job being reclassified, whether it was here or they moved to another job.
And again, when you move into a position, you take on more, excuse me, more responsibilities. You're being paid in accordance with that position.
But you know what the job is that you're taking, or you wouldn't be taking, is that correct?
And your position has a range, and I think that it's a kind of frustrating also for employees to see a range, but to never move in it. I mean, why do I have a range if I can never really move in it? So I think that is a concern, but I think the bigger concern too is the compression possibilities that happen, because you have this group slowly edging on this group because we're kind of staying here and they're marching towards, and you end up with.
You're talking about the bargaining?
Yes, and when I'm talking about comparison, what you're talking about with this study, it's about probably, I would guess, $40,000 to have somebody come in and actually do a comp study for us. It is a lot of work, and it's kind of difficult to diagnose your own problems sometimes, but then they would help us come up with a plan too. And but you know, I did send you the one from CFU that they just did. I did submit some data to them, so I participated in that study, and they sent us back their results. And I think we can maybe come together later after this. And,
But is that a fair assessment?
I don't.
Different culture, CFU compared to county government.
Well, my point is, Tom, is that some of the solutions they came up with how to compensate non-bargaining might be something we'd be interested in. And yeah, when you're comparing positions, it is difficult because, like I say, they're not always apples to apples. Ideally, they should be about 70% to be considered, comparable positions. But the equity that I'm talking about is all internal. I didn't really do anything with the external market in this. I just wanted to keep our internal structure sound.
No, I
fair.
think that's where we're talking about
Yeah.
comparing to other counties, and that's not at all what we're considering
No,
today.
this equity has nothing
Our
to do with what
equity
other counties
within
are
our
doing.
own
This is just internally comparing. We want to make sure that our supervisors are, making at least 5%, ideally 10% more than people they're supervising. You can't count overtime with that, obviously, but that's, and then internally, when you have people in the same pay class, so our pay grade, like we have multiple people in a GS 17, for example, you want to make sure that you don't have somebody who's been here, 15 years making less than somebody who just started.
And I'm sure that's happened.
And that's an issue, particularly if it becomes a risk for us if they're in a protected class. So
Well, we talked about this a lot last year. I mean, and that's why we agreed to do this plan. And
Right, it's
we
a short-term
certainly-
solution.
We certainly can change it, and certainly.
Well, I don't know if we necessarily agreed to do this every year. We agreed to last year. I guess.
Last year was that
agreed last year.
we had hoped that maybe we could,
I guess the fair question would be then to Linda, seeing that you're talking about it now, how would you pay for this? Where's the money come from?
But this $5,000.
Any of it? All these?
It comes in our budget. That's why it was proposed. Like I said,
But I mean, how do we pay for that?
I guess it'd be through tax
the
asking.
same way we do all salary increases.
Okay, so you don't have a problem if we got to raise taxes to pay these?
We should have done it all along, is what we're saying.
wasn't
is
my
we don't
question.
I don't care if that's your question or not. We haven't been equitable with our employees, and this is an opportunity, as HR has pointed out, they did last year. I think Debbie's actually the one that met with all of us last year and talked about this. because-
Regardless what we raise taxes, you think this is the right thing to do?
You mean regardless of what the amount is?
Yeah.
We did it in a phase-in so that we didn't have to look at that high dollar amount of 200,000.
Okay.
It was up to us to look at that.
Because really, we're talking about this, and it's a good discussion, Deb. I mean, we've had this over the years, and it seems like we keep spinning our wheels, but we don't even have a clue where this budget's at, because we haven't made any decisions. We haven't determined where Country View's at, because we haven't made any decisions. So it's pretty hard to sit here and talk about increases when we haven't even done the budget yet.
Well,
I
we
would
haven't-
think we'd do the budget.
We haven't
for-
approved it today. We're not approving it today. Deb is making the case for
Well, I
making the
understand
positions
it.
equitable.
And we've had a million emails on it, pretty much what Deb is saying and Susan, so.
I guess I'd be in favor of looking at a long-term solution, but I am also in favor of looking at these adjustments here as we did last year. I think that, we know that all of our funds come from taxpayers or grants or other governmental services. And, the step increases for bargaining units come from taxes. So I think we have an obligation to look at non-bargaining, see that they are compensated, not identically, but somewhat that follows the pattern that we have with bargaining unit
I
employees.
just know there's been some years our union contracts, and again, I agree with you, that were 0 or 1% increase, and we upped the non-bargaining for that mere fact of what everybody's talking about here today. Obviously, it's not a huge increase when you do that, but I don't disagree with any of you on this. It's just the idea, we haven't even done the budget yet. Are you going to approve a 10% increase in tax axings? I'm not.
I think you're talking about two different things now. You're talking
Okay.
about compensation. This is like and not to deliberate on a point here, but the $5,000 Susan mentioned is what makes our
Only
employees
$5,000.
equitable. These positions equitable with others in the same category.
Okay. I'll be curious to see how this ends up. Because it's got to come from somewhere, and it's going to come from the FY19 budget, correct?
Correct. That's why it's asked for in this,
When do these go in effect then?
July
I
1st.
suppose, July 1.
Fiscal 19.
Same time they get their 3% or.
Is that the 3% too then?
Goal would be to keep them at midpoint, so they would have to keep that. Otherwise, they'd still be behind 3%.
Be the same time bargaining units get their increases along with their step raises.
Which is 3% this year.
I just say I appreciate the time we've put into this because I think we've got a liability for the county that I want to avoid, and so I support going through this process. But I'd also be interested in coming up with before next year what the long-term solution is to this problem.
The reason we're having this discussion anyway is from years past where things weren't rosy, so things were done by supervisors that it's affecting us today. So, and I agree that they're needed, but there's a time and place. And like I said before, and I'll say it till my dying day, I don't hear anybody complaining about what they're making. And when I work wherever I've worked, I never knew what the hell one of my fellow employees was making. It's none of my damn business. I don't know what anybody makes here other than I see it, and I could care less. They're being compensated. I don't, like I said, if they've got a complaint, I haven't heard my phone ring about them.
If you knew two people in the same office were doing the same job and one was doing it for less money, would you have an issue with that?
I wouldn't know it because it's none of my
But don't you
business.
care about it? But don't you care about it
It is
as an
public
employer?
record.
Well, as an employer, but I got to answer to taxpayers too.
I do too.
Unfortunately, the culture I came from, that's the way it was.
Yeah.
3 people
Yeah.
doing the same job and all
And
three
all
making
three
different money.
different wages.
It was just a way to keep that company afloat. Same way we try to keep the county
Yeah,
afloat.
because
I'm
not.
not saying it wasn't
well,
done in the past.
okay, and you can take 2 employees and take two employees that are doing the same job. Those 2 employees aren't working at the same rate. People do their job at a different skill level and stuff. So, you got that added in. They had all sorts of ways to. We'll continue this conversation.
We need to look at a long-term solution. We
Yeah.
really
We do.
Yeah.
It's
Yeah.
way past due.
I don't know how long that would take for us to
happened
do it, if
between-
we could do it before next year or not.
We'll work on it now that I have staff again.
If not,
But
Yeah.
I think, with the magnitude that it would involve, you'd have to look at some type of a phase-in because,
Sure.
much like we're doing here,
Yeah.
Right.
because I don't, we talk about asking for tax, do you want to ask for 200,000 or 300,000 in 1 year to make the adjustments, or do you want to spread that out?
Don't know that until we see a plan.
You're right, I don't know those.
I've had
those figures.
4 HR directors talk to me about exactly what we're talking about today. So this is a subject's been going on for years.
It has.
It's just that it has to be,
Equitable.
I appreciate bringing up the conversation, and it is part of our decision-making on where we're going to set taxes for
Exactly.
fiscal year 19.
thank you.
Thank you.
thank you.
Can I make just a couple comments? I don't want
Sure.
to prolong it. The reason I said only 5,000 is because last year, the total increase, total adjustment was 60,000. And so, in my opinion, I was looking and thinking, well, this is good that it's much less than that.
If we kept.
Not that I don't consider.
No, I
the-
understand that, Susan. Rory went down
taxes.
that road a few years ago and said only, and I think
Okay.
he was corrected at that time.
But also, since we started this last year and we dealt with those employees and made those adjustments, and there were several long-term employees we had last year who were, way behind in their pay scale. There were some people who did not make the cutoff. And so, but the HR's recommendation was to be fair and be consistent, we had to have some sort of cutoff, and we cut it off at a point where, everybody with at least 3 years. And I have heard from several department heads about this issue, concerned if the county was going to continue to do these equity adjustments, because now, if we don't continue, they're going to have people within their department who, with a greater equity problem. And that's a concern for some of them, and I don't know if any of the department heads want to speak to this issue, but
They
I just
should be
wanted to point that out.
contacting HR rather than the county finance.
Also, a question on the CSS, the $7,100 there. Explain that. You're saying that's not part of it?
That's the people
Well,
that.
those
fall
are
out of it.
individuals for county social services. They're paid out of the mental health
Right.
fund, and so that mental health levy has been set, so it wouldn't impact our taxes this year. It would impact the county social services budget. And like I said, they're already looking at putting all of their employees under one umbrella simply to kind of avoid these equity problems. If they have a county that does an increase of 3% and another county that does an increase of 4%, then they've got an issue within their organization. And so in order to avoid that, they're looking at a plan to try and put all their employees under one
Well, let me ask you this.
payer.
Those employees operate under the CSS board. Would that be the board that would be taking action and not the individual board of
So-
supervisors?
So the agreement does give the County Social Services Board the authority to do that, but it's been a practice that each individual, that they've followed the each individual county's plan. So in practice, the employees that we have for County Social Services receive whatever non-bargaining increase that the board authorizes each year, and, has that pay plan. But I think they're slowly working towards trying to get a new system for county social services.
And as far as the treasurer's office individual that's up there, she is one of my head supervisors, and I have talked to HR several months ago, and then also talked to Susan. Didn't come to Craig because it's something that we don't go through. We go through HR, we go through the finance. And
HR is the proper place to go through.
And so I have talked to Debbie about it before, and knowing this equity was going to be talked about, I didn't pursue anything more for that fact, because at least it would be more fair, because the individual missed it like by 6 or 8 months, cut off last year, and she was do that increase. In my eye, she even probably should be deserving more, and yeah, maybe something I'd pursue a different avenue with a requester. But I just want to go through this route because at least it would be fair, and Debbie's been working wonderful with this, and again, with short staff and that, it takes time, that desk audit, going through all that, point system and that, when they're busy with so many other things.
See, the board a few years ago gave an equity to the departments to use as they choose to bring people up to certain levels.
That was before I became treasurer.
Yes, it was. And what did departments do? They gave it to everybody. So the intent was to try to give it to somebody. Huh? Well, I'm talking about. No, I'm talking about some of the departments. It was given, and I know the treasurer's office was one of them that just flat out give it to everybody. So that's the reason why the board never offered it the following year.
That I was not part of that, so
No, I understand that.
Well, maybe that's something we reinstall, because maybe it didn't work then, maybe it's something with some guidance that could be made to work, if that's that's kind of a merit type system.
It was a merit, yeah.
But just because it was abused or not used correctly doesn't mean you
Listed
couldn't
in
try
the
it again.
policy.
And just, if I can comment, for with the health department.
Nafisa, you want to come up here so we can pick it up?
Even though we don't want to do external comparison, I have had a number of employees in the past 2 months that have retired, and recruiting has been extremely difficult because you are getting new graduates. And you want the top person to really consider coming to work for Black Hawk County, and so when they look at other counties in comparison to what they're going to be paid, they're going to choose the other county, and it's I think it's important to put that out there. The second thing is that employees are not coming to say things because of also, I think, the relationship, and you are the Board of Supervisors, and so we hear it more internally, and you get a very good employee who's working really hard, does above and beyond the 40 hours a week, and you know, I hear stories about I can't make ends meet with this amount of salary, and I'm working really hard, and I do communicate that with Debbie Bunker. So I just think that you all are not hearing it just because of the relationship, but it is happening, and it's something that it's really worthwhile considering, because I know for public health, things are changing and becoming more technical. I need individuals that are actually really good even in understanding quantitative numbers, and it's been really hard to get that. So I just want to vocalize that. Thank you.
Thank you.
Okay.
Good discussion. So what raise you want to talk about now?
Okay.
Not yours.
Yeah. Okay.
Yeah, please don't bring that one up.
All right. Well, we have now heard from every department, and I've sent you some information on the overall where we stand right now. Just want to kind of go over some of that. Let me go down here a little bit. Just in summary, looking at the general fund, just a couple comments. This little table, see if I can make it bigger. And I think it's in the packet with all of those scenarios.
Small print.
Yeah, it's this next page like this.
Is that the one you're going to discuss right there?
Yeah, that's the table up there. Let me pull it up in the other. This table. So I guess, well, starting with assessed and taxable valuations, as you all know, there was very little growth this year. So total assessed valuation grew a little over 1%. Due to the rollbacks, total taxable valuation was a little under 1%. Rural taxable valuation actually decreased slightly. And then for the debt service, a little over 1%. And then the rollbacks, the residential rollback decreased. There was an increase in the agricultural rollback. Commercial industrial stayed the same. Multi-residential, again, went down. But looking at the general fund budget requests, in summary, departmental revenues, looking at a slight decrease of $75,000. And I just sort of broke out on the increase, decrease, a couple things. Hartman, just because that sort of skewed the numbers. Last year in FY18, we had budgeted revenues of $400 for Hartman, along with expenditures, capital expenditures of $400. So I broke that out so you could see that really overall departmental revenues are decreasing $75,000. And then a decrease in, a little decrease in tax credits replacements. We can talk a little more about the commercial rollback. But looking down at expenditures, due to some changes, due to restructuring in the health department, due to the continued transition between deputies to civilians, salaries and benefits, and because we only had a 5% increase in health insurance, we only saw a 1.8% increase in overall salaries and benefits in the general fund. So that's lower than what it would have been without some of those changes. And operating expenditures, we're actually looking at a very small decrease. And I just want to mention that in working with the department heads, everyone was very conscientious about spending taxpayer dollars, looking for ways to save money within their budgets. And over half the departments submitted budgets with a reduction in operating expenditures. So capital is the area where we're seeing the big decrease, and that's because we had $1 million budgeted last year for the jail security system. And so that is that 729,000. And then I broke out the capital that is being budgeted from reserves. So I just wanted to, yep.
So where are we at right now in tax askings?
Okay. So that's the page I'm going to go to.
What percent do you have?
Hold on. So it might be easier. I gave you all of those scenarios, but the one you might want to look at, since it's easier on the eyes, in the packet that I handed out this morning, if you go to the third page in this FY19 tax askings worksheet, there's sort of three tables. One is the tax rate, one breaks out the debt service funds, and then one is the tax askings. Let me go to that, sort of here in the middle of the page. So for the general fund, basic and supplemental combined, we're actually looking at a decrease in tax askings of $100,000. County social services, as we discussed last budget session, that levy is set by the County Social Services Board, and they are looking at an increase of $247,526. Then we have a small increase in debt service, and then the other larger increase is in rural basic, and that's because mostly what's in that is the patrol salaries and benefits, and unlike the general fund where we were transitioning to civilians and restructuring and health, the patrol is all deputies, so we're looking at an increase there with the salaries and benefits. And so overall, total tax askings looking at a $418,000 increase.
So 1.1%.
1.1%.
And that's not including what?
This does not include Country View. And
Does that have capital?
yes, it includes capital.
So it's only Country View?
Country View, and right now, as I mentioned, I have put in the same amount of funding for the nonprofit agencies as we had last year, which was $60,000, and I left library funding at the same.
60,000 is in there.
60,000 is in there.
Want to visit that.
And there's no proposed bonding.
No proposed bonding,
So,
but
yeah.
the phone system is in there. All the capital that's been requested is in there. Except for you received an email from elections. They've sort of had a change. Now, I did pull out on some of those capital, coming up here, Rory spoke with the sheriff, and he was able to move all of those jail capital requests, 41,000 of those, to the jail commissary. The sheriff is going to be able to pay those out of the jail commissary funds. The only one that couldn't come out of the commissary was the polishing of the patrol room floor, and that 2,100 will come out of the sheriff's room and board fund. So those are coming out of basically reserves. Also, the renovation for the attorney fine collection area, that's coming out of reserves. The ones that typically come out of the attorney fine collection, it's 122,000 total, but 97,000 of his capital. And I actually need to check with Brian on the courtroom renovation because I think that is actually in this year, and I need to clarify.
So the 1.1% number you just gave us?
Yeah. I also have elections. What they originally requested was 40,000, and I have that coming out of the supplemental reserves currently. But all of those decisions haven't
Okay, the
been
capitals you just talked about, are they in or out of that 1.1?
They are in, but those items I just mentioned are not because they're going to come out of reserves.
Okay, so do we need to deduct those jail capital you talked about?
I already did.
Oh,
Yeah.
so they're
Yep.
out of that 1.1?
They're out of that, yeah.
So the only thing you're looking for in that 1.1, everything's in there except for Country View?
Right.
And then if we want to reduce the nonprofits when we go through those?
Right, reduce or increase. We have a new one, that Riverview Center is new this year, I don't have anything in there for them.
So the other part would be the telephone system's still in there.
The telephone system is in there.
That's one of the biggest ticket items.
Yeah.
So with that tax askings, come up here to the tax rate, what that results in is a slight decrease in the urban rate from 641 to 639, but an increase in the rural.
Sounds like we're gonna get our commercial backfill.
This year.
So it does, and I do have that included
Yeah.
in this budget. And I did break out, just for your information, the various debt service levies and rates there. Okay, so if you want to look at some scenarios, that's on this page with all of them.
So which worksheet is that? You may have
Actually,
to start
no.
numbering.
We're back on the tall one, I think.
Let me, let's go look at Country View for a second. And I think Genevieve had to leave. No, she's here. Okay. Okay. Country View, basically what I did, Country View is very hard to estimate. We estimated this year and we were pretty far off what we're actually doing. But I have FY17 on here. The average census for FY17 was 145.79. FY18 so far, these are sort of based on December numbers where they're at, and then projecting that through the rest of the year, and keeping our current census, which I think is 133 or 132. So we'll average out a census of 134. And right now we are looking at a loss, adding back depreciation, but taking into account some capital expenditures of right about $2 million. FY19, I did, and this I had done before I received the email that we did receive those rate letters. So in talking to Genevieve, I think the NF rate's around 171. Is that correct, Genevieve? Anyway, I had plugged in an NF rate of 191 for FY19 and a census of 132, which is our current census, to come up with these estimates. I did leave our county social services supplement. It looks like we're going to average about a little over 1.1 million, and I left that the same for FY19. I did receive a visit from Bob on Friday. County Social Services, and Craig can speak to this, they are going to need to cut about $2 million from their budget. One of the things they are going to be looking at, or possibilities, is their funding of Country View. So this is sort of in question. And then expenditures, a little difficult, but just taking current salaries and benefits, taking the December figures and putting the increases on there, coming up with that. As you can see, I did increase in FY17. We were able to cut back on the outside nursing. Our total was 416. We really increased it back again this year, and if we continue on pace, it looks like it'll be about 817. I left that number in just because we are having such difficulty hiring out there. Operating expenses I left flat, and I'm coming up with a loss with depreciation in there, and that's 2.5, but looking at a cash loss of about 2.4 million. If we don't receive all of the funding from county social services, that could really increase.
How much funding do we receive?
Up here, 1.1, a little over 1.1. They have budgeted 1.2.
You got any idea? When are we going to know?
He didn't know, and their budget isn't due until after ours is due, so I don't know.
In other words, if they eliminate $1 million,
then we're looking at a $3.5 million loss.
but that's all after the fact I mean, we'll probably be done with our budget, right?
Yes.
So that means that
So-
would be $1 million coming out of the reserves.
Right. Well, we'll need to make some decisions on what we anticipate, you know.
Genevieve, would it be,
just-
in your opinion, if the future was certain for folks out there, would we be having as much trouble filling these positions and having to rely on nursing agency so much more this year? And do you think that the census would also be higher?
Genevieve, do you have or Dennis?
Good morning, Board. Genevieve Schaefer, Assistant Administrator. I think when we're looking at the question that you posed, it's very multidimensional. First of all, we have to realize that we are facing a national shortage of nurses, especially here. There are certain factors when you compare the benefits to other healthcare providers in the area that we just can't compete with. Nursing home work is very challenging. It's very regulated, and it's a 24-hour facility. With the future, I think if the future was a little bit more certain, I think that would relieve a lot of people's concerns. It would make probably employment more stable and help us to attract the better kind of employees we want and employees that want to work there. But if we would be able to fill all of our employment vacancies right away, I cannot attest to that.
Because we've had an issue with agency being a large portion of the budget for quite a while.
Yeah, we've had an issue with agency being a large portion of the budget for several years. I mean, this goes back to, 2011, 2012, where we have had significant issues with overtime and agency.
But one of the main contributors, that is the FMLA leaves, right?
Yeah.
I think, we talked about we'd be able to increase the resident numbers. But from my standpoint, the reimbursements from the MCOs is running about 80%. So the higher we have census, the more dollars we're
That is correct.
not going to cover our expenses.
The higher we also have census, the more staff that it requires to take care of our residents, the more we have
So
to.
I guess I would focus on, the county's going to maintain country view, that we look at the census and, as stated before, try to get that into an area that makes sense for the number of individuals, particularly in the nursing area and the NA area, that we make adjustments and reduce where possible, where they would have an opportunity to move to a different type of facility.
Yeah.
And I guess just to point out, when we visited, the only other county-owned facility in Iowa that we can sort of compare ourselves to, they've averaged a loss of 2.8, 2.3, I can't remember. And I know one year I think it was over 3 million. So it isn't that. I mean, I know we've talked a lot about
along
trying
with
to
their
find-
figures, they're adding about $1 million
Right.
a year from another taxing fund
Yeah.
that provides for facility
Making-
improvements.
capital improvements. So
So if we're going to be in this long term,
I think we just
could
need to
look at
recognize
$3 to
that
$4 million.
this is going to be our loss, that, in this type of facility, we are not going to make a profit or break even. So just point that out. But anyway, I don't know that we want to spend too much time on talking about that. We've talked about that a lot, but just to give you some of those ballpark numbers, and then we can look at some various scenarios. So this one, and I apologize, there's a lot of numbers on this page, but up at the top little table is the property valuations. This next little section is tax askings, which we already talked about, the increase of $418,000. Last year, if I have that right, part of that is that we had that $1 million in for the jail security last year, and that's part of why we aren't seeing such a high increase. Down here, then we have the tax rates, which we already just looked at. But then we get to the impact on the various types of property. So where we are currently with the rollback for residential, they would be looking at a decrease of $9.77 on a value of 100,000, and that's mainly due to the rollback. Commercial and industrial, a decrease of $2.12. Agricultural, because that's the area where property values did decrease. The rollback increased, and our tax askings increased for the Rural Basic Fund due to the increase in salary and benefits for sheriff deputies. So that is the biggest dollar increase is on agricultural. Right now, looking at 8112. Multi-residential, a decrease of 2591. So then, across the bottom, this spreadsheet that I emailed to you has various scenarios. If we add in, 1 million for Country View, 2 million, 2.5 million, we can look at each of those.
Isn't it about 1% for every 300,000?
Yes, it's about $10, for every million.
So you show 2 point what up there?
Yes, so if we go to the 2.5 million, which is what we're estimating Country View's going to lose, then we're looking at an increase on residential of $15.87. And ag would be 106.21.
What would be the tax asking increase percent-wise?
Tax askings, if we added in the 2.5 million, it would be 7.76%.
And that's including the 1.1? Where we're currently at?
Right. I did look at a couple different scenarios. The only high-ticket item, as you mentioned, is the telephone system this year, which wouldn't be worth bonding for. But we do have some, and we discussed this when we talked about the engineer and the bridge bonding. We have some fund balance in those debt service funds. And I did look at we talked about using some of that fund balance when we do go to bond for that bridge. But we could use some of the fund balance this year. We have almost $2 million in the Roads and Bridges Debt Service Fund, and I have my number real handy. On the CIP fund, we also have a fund balance in there. So this next tab was using, and then also for the rural fund. Last year we did budget to use $200,000 of fund balance in the rural fund, and that was to try and bring that increase down. So this tab here is using $600,000 out of the debt service funds, both the roads and bridges and the CIP, and $100,000 out of the rural fund, and that would bring tax askings. Hold on. That would bring tax askings to $1,718,000 or 4.57%, and that would be an increase on residential of $5, 1.39%.
What would that do, taking money from one area to pay this? Where is that going to affect us down the road?
So let me pull those up hold on. This is our roads and bridges debt service fund. Sorry, you can't really see it all, and I didn't print this out for you. Our fund balance at the end of FY17 was $1,986,783. From 14 through 18, our tax askings for that have been ranging between like 3.4. The highest was 3.8. In 19, we only need about 3.38. So then moving forward, we're anticipating bonding for that next year. For the Cedar Wapsie Bridge, if we do the $4 million that we had discussed, and when we met with the engineers department, we actually, might not need the $4 million. But the $4 million over 8 years would be approximately $575,000 in principal and interest. So beginning that in FY20, then this would be our total going out. But because we have a higher than necessary fund balance in there, we could use some of that. So using $500,000 in FY19 brings us down to 2.8, and then using another $500,000 brings us down to 3.3, and then moving out, we can maintain that 3.3 because we've got some debt that drops off in FY21. So then, if we're not planning any other projects for the next several years, we'll be at that 3.2, 3.3 level until FY24, when then we really drop off again. And the graph on that down here looks like that, and that is using $1 million up out of that fund balance, but then maintaining our tax askings in that fund. That is the roads and bridges. The CIP, we ended FY17 with a fund balance of 420. I don't want to use too much of that, but if we could use 100 maybe this year. I don't know that we would need 100 next year, but we could use 100 out of there. We've been averaging 1.2. We were high in 16. But then dropping back down. This year it's 1.4. We had the debt issue last year.
The 420, is that bond money?
The 420?
Yeah.
Which one?
Fund balance, was that bond money?
Yes, yeah.
And you were able to shift that over to another area?
No, it's not bond. That's what's accumulated in the debt service fund.
It's not bond money.
No, the bond proceeds are in the capital fund. So this is in the debt service fund. So this can only be used to pay down the debt. Anyway, we'll be high for a couple of years, and then we'll drop off. And that, again, in a few years, we've got a pretty significant amount of debt that is going to drop off. So that's what that looks like. But
Susan, you have a scenario if we put $1.5 million towards Country View and did not do the phone system, what our tax askings would be?
It would be this. Hold on.
And could our reserves handle it if we had overages?
So you're saying, Frank, another $1 million then out of the reserves as we need it?
Possibly.
The $1 million here.
Because I think she has a scenario that if we use $2 million in reserves, and what I'm proposing is about covering about $2 million of it if we didn't do the phone system, still leaves us at 25.5 in reserves.
The only problem with that is Bob Lincoln's budget does something, then you're talking another $1 million out of the reserves.
Well, I think that's where we need to control the census numbers.
And then this is just operating. It doesn't cover any infrastructure, the chillers or anything that we know are getting near the end out there. When something goes down there, we have no choice because it is a facility with residents, and it'd be money we'd have to draw right out of the reserves. And so far, it looks like chiller system is one that's going to be needed work first.
I'm sorry, Frank, what scenario was that? Adding 1.5
1.5 million.
for Country View?
And taking the phone system out of the capital.
So the phone system we have in at,
3-something, I think.
375, I think.
oops, sorry,
Rory's right there. What is it, Rory?
I think it's 369 or something.
332,000. So the total was 364,000, but 31,000 of that was for Country View. So the total that is in the budget is 332,000. So, I mean, that would be pretty similar to your 1 million, additional in tax askings. Which would be, only a 49-cent increase in the taxes on a residential.
All right. That word.
I mean, let's find out.
300 out.
Okay. So you want 1,500,000 for Country View, but 332 for the phone. Okay. Hold on. Maybe I didn't do that. $2.21. I will double check that.
So it would be the percent.
And that's taking out the phone and putting in 1.5 for Country View.
Yes.
Okay.
Leaving the operating about $1 million short.
Without adjustments.
Yeah.
I would really like to see us, though, consider aggressively looking at reducing out some of the census there, just because we've said for so many years that we are the place of last resort. But we've heard from Bob Lincoln, and we've heard from Dr. Pomerantz, and we heard from the people from DHS and DIA that they thought there were people that could be in other facilities that were as good a quality of life or better. And so if we could reduce that population, if we consider that, and if we can't, that's what I've said all along. If we can't reduce that population, if that's not a true statement, then we are showing that we are the place of last resort, and we go to the taxpayers and say, there is no place for these people.
What's the odds of them taking back the funding that they're giving right now? Have they talked about it?
CSS?
Yeah, I would imagine we'll probably have to anticipate it.
Yeah.
Because the last thing I want to see us do is get
We're the
forced
big
into a
county.
situation where people's
That's true.
health is, where they're in jeopardy, and then we have to close it.
Well, the thing
Because
is,
the Department of Human Services will come in if they feel all those people are at risk and help us, and that's exactly what we said we didn't want, is the trauma for those individuals.
No.
we're also the only county, Craig, out of the 22 that has the home.
Yeah.
So I can see why that's
Yeah.
swaying the other way.
But the other 25% of the people that are out there are from the other counties.
Yeah.
At least 25%.
So if you took his scenario, what's the tax askings percent-wise?
Just showed you. You weren't paying attention.
Yeah, sure.
1,586,000 or 4.22%.
So it's a 4.22 now?
You can verify it later. You can verify it later if you're not certain.
I am.
It's not.
I just get a little nervous on it.
I'm just saying, yeah. We'll be back on Thursday.
I did send you those fund balance estimates. Maybe. Okay.
Yeah, I think with, you showed with the 2 million that our total general fund balance would still be at 32.6, and our unassigned would be at
Yeah,
25.5.
correct. So based on the budget we had originally, and then using 2 million out of reserves, not budgeting anything for Country View, that would bring us down to the 25%. Taxing for $1 million and using 2 million of reserves would bring us just under that 25% in the unassigned, and at 31.8 in overall. And that's assuming, that we don't have any budget savings, which we typically do, so.
Yeah.
I guess without looking at how we can adjust expenditures out there, and that means the number of residents that are serving in the nursing home side of this, I wouldn't feel comfortable taxing the full amount of 2 to 3 million.
Yeah, but I see what you're trying to do, Frank, and it makes sense, but it really all we're doing is fudging the numbers. We know it takes $2.5 million minimum to operate it, so you're going to take $1 million out of reserves and hope like heck that we don't lose Bob Lincoln's funding. Then you're going to take $2 million and then hope like heck we don't have a chiller replacement or something else out there. I know it makes it look.
I guess we
good.
can
It makes the budget
tax
look
at
good
7%.
if it passed at 7%. If it passed at 7%.
This scenario with 2 million and using some reserves out of the debt service in rural, has tax askings of 1,718,000, 4.57%. That's actually the same increase we had last year. With an increase of $5 or 1.39% in the amount of taxes on a residential.
Really, looking at the budget overall, our departments all came in excellent as far as their operating.
Sure.
And the capital in most of our departments was
Minimal.
pretty minimal too. I'm sure there's some areas we could cut yet in capital, but operating again, and we kind of knew that there could be some departments and capital affected by Country View to maintain the status out there. So it is what it is.
Rory here?
Yeah.
I think he's here.
Behind us.
Yeah.
Oh, he's, yeah.
Time out.
Did you address the phone system, whether or not that needs to be addressed in the next fiscal year, or whether that's something that could be addressed in 2020?
As of right now, the phone system, we still have support. So as of today, we still have support for our phone system the way it sits. It's just the anticipation that moving forward, we're at the end of that cycle of life, so that support will eventually go away. But Marco, who is our service agreement company, has indicated they don't know when that support will go away. So can we get by another year? I would say there's a good possibility that we could. If that support happened to go away, though, and we had some issues, that could really put us in a bad situation.
How much notification, or is there any when that goes away?
That's a good question. I will have to ask that. I can't answer that today.
I'm just curious.
We have contract
Give
with
us
them?
We have a contract for servicing our existing
But
system.
not support?
Part of that contract includes the support.
How long's contract good for?
I want to say we have, I don't know if you have our contracts available, Susan, but I think we have maybe one more year left on that contract, if I'm not mistaken.
Okay. What was the estimated time factor if we switch phones?
As far as implementing to the new system,
Month, 6 months?
I would have to get back to you on that, Tom. I couldn't answer that today.
I'd like
Given-
to reiterate the dire situation we have in elections when we have a general election, the inadequate phone system that we have now and the number of drop calls that we have. And if you don't get this new system, I've talked to Rory about what other possibilities are. There don't seem to be a lot of alternatives, but I hope that you will look into alternatives if this new system doesn't pass, because we're just expecting that situation to get worse.
Grant, what's the impact of that?
I beg your pardon?
What's the impact if it gets worse
Are you talking about a monetary impact or on the public? Or
on the public?
Well, when we have a busy election day, like we'll have this November, you get a lot of phone calls in with the public and with precinct workers trying to get questions answered. It gets very hectic. We only have 3 phones that operate in that office, and so you can't manage all of the phone calls. So phone calls get dropped. That leads to disappointment and discouragement on the part of the public. It can mean people ending up not voting or not having their vote count because they end up having to vote a provisional ballot. It's it's something that's hard to quantify, but it leads to public dissatisfaction and less belief in the integrity of the election system.
How's the new system change that?
From what, well, Rory, you can explain it, but I understand that we can add additional lines so that we could take more calls.
Can we add additional lines now to his 3?
We can, it depends on where our DIDs are currently at as far as space, but there's a good possibility we could actually add lines, but what this gives us is the flexibility to move those lines as elections come up. If they need additional handsets in their room, it just gives us that further flexibility.
But currently, you can add in elections office.
I would
election
imagine,
time temporarily additional lines.
Yeah, it's a programming issue. It is somewhat time consuming to do that, but I'm sure the possibilities there. Like I said, as far as benefits for the IP system, as the informational packet that I had passed around to the board, there are benefits to the system, but more importantly, it is just the support that we will be losing out on moving forward if we continue with the digital system.
Thank you for bringing that forward.
Thanks, Roy.
Thanks, Roy.
To say back to the question at Country View is, I try to talk to everybody, every resident in this county I see, I ask them their opinion on this. I give them a range of between $11 and $15, and I haven't heard from a single person in this whole year that says the Country View is not worth it to them. I haven't had a single email, I haven't had a single phone call from anybody that says that those folks aren't a priority and that they're not willing to pay a little bit more to keep this facility running. I do think, we see this push at all levels of government to privatize and to sell off all the public goods, and I don't want to see this county government be a part of that push, which has not been good for our country. It's not been good for our economy, and so we've got 170 jobs out there, 170 good-paying union jobs that support a lot of working families in our community. I don't want to see us lose those. I don't want to see those unions get busted. We've got 134 residents out there that I think we need to seriously look, and as we have new leadership next year, that's one thing that we want to work with them on, is that we are examining if there are folks that we can put in other places, then we don't want to move them there. But we want to do it in a way, and if we're going to move folks out there, we need to do it in a way that's significant enough to actually reduce our staffing needs out there, because we run the risk of, if we're just lowering the census but we're not lowering it enough that we're reducing any staff, then we're increasing the shortfall. And so I think for me, I think for everybody I talk to, and I just encourage the public, if they think otherwise or they agree, let us know. We want to hear from you on Country View, but everybody I hear from, they see this as a public asset, and then they want to maintain it. Especially when you think about the conversation about mental health that's going on. The state is failing us. The federal government's failing us. We've got a facility out there that's run by this county that has mental health beds, and I don't want to jeopardize that either. I think we need to be going in the other direction and increasing those types of services. And so that's where I'm at on Country View, and I want to see it included in this year's budget.
I think it has to be in this year's budget. If we made the decision to close it tomorrow
Right.
and move toward that,
2 or 3
we'd have
years.
to keep it open for a while for that transition anyway, so it's not like that's.
I think that, I understand what you're saying, Chris. The disadvantage we have as a county is that we have one facility to operate. And in that business world, they have multiple facilities that they can draw on resources to, as HR or as any other legal part or working with the MCOs. They have a greater resource to do that. And I think as a single facility, we're at a disadvantage to compete with that.
I think what hurts us, is that we rely so much on Medicaid. And I think that the dam's going to break on Medicaid at the federal level in the next couple of years, because it's going to start hitting home when everybody's grandma or grandfather has to come home. And we're not just talking about facilities like Country View. That's going to happen all over this country because of the constant attacks that Medicaid's been enduring from the right for a long time. And I know we've got long-term capital needs that are going to be out at Country View, and that's why I'll bring up again the only model I found in the Midwest for a county-run home that is now turning a profit is there in Rock Island County. And what they did, they bonded, built a brand new, beautiful facility, and it was attractive enough that they were able to attract both short-term Medicare rehabilitation, which we heard the analysts say the demand for that's going to start to skyrocket in 2020, and they also have private pay, and they got it down to a point where it's about 47% Medicaid and the rest is private pay and short-term rehabilitation. And with that, they're actually turning a slight profit right now, including paying off that bond. And so there are models out there for how we can expand, this service and make it not only a service to the 134 vulnerable people that we are out there right now, but also provide another option that would be available for everybody in this community's retirement needs and short-term rehabilitation needs, which I know as more baby boomers retire and age, the demand is just going to go up and up.
Well, I don't know much about the community you're speaking to, but I said if we didn't have those resources in our community, we have an abundance, quite honestly, of long-term nursing facilities. A lot of them are struggling, I think, just now with the Medicaid reimbursement is hitting a lot of them as well. But if we didn't have those services available in our community, I think that might be something to consider, that we'd be offering that in our community. But I see that now as just competition or competing against the private sector and the nonprofits, unless they were telling us they were full. If they said, too, they could take no more people, then, to me, then we'd have to take care of some of that population. So I always think that's something to consider as well.
No, I know that there's a current surplus of nursing home beds in our community, but I think if we're looking 4 and 5 years out, whereas if we bonded to build a new facility, we'd be looking at 4 or 5 years out before it actually opened. And that's when everybody's saying that we're going to see this massive increase in demand for short-term Medicare rehabilitation.
I think we're going to leave all options on the table.
Yeah.
Yeah, and what you said is true, Chris, but there are also the people that are out there, most of the nursing homes don't want them,
Absolutely.
unfortunately. A good percentage of them, because they're hard to work with, and they're still human beings. Anything else?
I guess along with that, states control the licensing of those type of facilities, and I don't have a lot of optimism about what we can work with the state on this.
Yeah.
Right now, the nursing.
Susan, do you have anything else?
Well, I'd kind of like to kind of figure out where we want to go from here. This is the list I put together. I handed it out this morning, but this is, I combined everybody's capital requests onto one. I know last year we went through the capital request again. We can do that on Thursday. We need to look at the funding for the nonprofits. I guess I feel we've seen all the departments and we've looked at some scenarios, and I'd like to see us start making some decisions. So on Thursday, we can put on, we need to put on the resolution regarding the compensation board.
Yep.
And then I'm not sure if you're ready to start making some decisions on salaries, capital, any other board agency funding, and any other changes that you feel are necessary to the budget. Do we want to do that on Thursday?
Yes.
I think we need to go through the capital and then again the agencies to see where the
Okay.
majority of the boards
How many
feels.
agencies did we have come in?
Let me pull up that schedule right now. Oh, hold on. Okay. So right now, this is what we had funded in FY18. These are the agencies. We had a request from the food bank, Operation Threshold, UNI. We had a request from NEI 3A. There wasn't an amount on there. We had legal aid, and then we had down at the bottom here, this is our new one, Riverview Center. As I mentioned, I do have the amounts that we have here for Food Bank, Operation Threshold, UNI, NEI 3A, and legal aid. Not that these three here, but these top ones down to legal aid, that's what I have currently in the budget.
Who has it? Has everybody that you budgeted so far, have they been before the board?
No, NEI 3A, I don't know if they've responded to Dana. And Operation Threshold wasn't here, were they? I can't remember. I mean,
They get funded through county social services.
Um,
Don't they do? I think they have a contract or something.
NEI
like that.
3A, yeah.
then the library's down here, and he was scheduled to come, but was ill that day. But we maintained their funding in 18. We kept it at the same level as 17, and they're requesting an increase of $5,000 in
What's
19.
that percent-wise? Is that a 3%, 2%?
I believe it's well here.
Yeah.
Sorry, it's just been a long.
It was in the letter, but yeah, I've forgotten to.
Here. 3.5.
You know, why don't we Thursday then go over the nonprofits, library, we can do the place on file the resolution for compensation board.
I got that scheduled. Oh, yeah.
And then we can talk salaries if the board chooses.
Okay.
Elected official salaries.
Do you want to go through capital then? Do you want to do
We
it
can
now?
do it all.
Yeah, maybe
it all.
look through the capital again,
Yeah.
because I said just to kind
Okay.
of review it wouldn't hurt.
Okay.
think.
You don't want to do it today, though? You want-
It's
Okay.
on Thursday.
Okay. Is there anything else that you need to see?
Do we got a spreadsheet of that?
The capital? I just handed this out this morning. This has all of
It's on one of
them.
them.
Yeah, it's,
And I guess if you could, I know you've done the scenarios with Country View, but if you could relook at those
sure.
so that we'd have a
Can you just
clearer picture of,
segregate 3 of them, like
Yeah.
Frank had a plan, the full amount of your plan of 2.5,
Yeah.
and you kind of narrow it down.
I'll put 'em in
to
a small
3,
table,
and
yeah.
then it'd be easier for the board to view them
Sure.
and point.
What was yours again, Frank?
I don't know,
It is
I
1.5.
talked about $1.5 million, but,
Yeah.
you know,
So-
I'm not sure we can continue to put off the phone system.
No, that's what.
So it's more like a 2 million, would be 2 million for Country View.
So you're gonna leave that 300,000 in for the phone system?
We're going to talk about capital
We'll
Thursday.
talk about it, but I think it's
Yeah.
something that,
I think in today's world of cell phones, I think those would work. Anything else to come before us this morning? I guess, yeah, it still is this morning.
Motion to adjourn.
Second.
All in favor?